Yes. So what's a consultation like? I would say that there's some similarities between every consultation, but there's also some differences. So that basically, as I think I mentioned before, is that I go into detail, ask them questions about their symptoms and when they started and what they think the factors are, and looking at their history, medical history, family history, teasing out symptoms like they've never been asked questions before, and oftentimes people the sort of the switch starts going on, the light starts glowing because they start to through this question and answer start to tease out. Well, yeah, that you're right. That's maybe when that happened, and I had never thought of that. And those are jewels of information that really help a lot. Then there's always labs to review, and we look together at the labs, and I explain the chemistry. I explain, just reviewing thyroid hormones, what the different thyroid hormones do, and why there's the imbalance, why their levels are suboptimal. We cover TSH and how the conversion of one hormone to another, one thyroid hormone to another thyroid hormone is like. I feel at that moment that they're learning, they're being empowered, they're not under. Um, they've been told so many times that all your labs are perfectly fine and you're healthy, and they know they're not. And so when we look at labs, we're not looking to see that their results are in that sort of normal reference range, because that reference range was established by testing, people from our unhealthy population, and that as long as it falls in that range, then the doctor says you're normal. But we're looking about where would a person in vital health, where would their result be? And you're down here, and how can we get you up here and many different ways of doing that. So that's another part, is reviewing the lab results based upon their symptoms and help them understand what the labs actually mean. Another part of the assessment is doing a physical exam if that's important or necessary. Blood pressure, pulse, looking at their tongue, their eyes, their skin, etc. And then usually most people will look at their blood under the dark field microscope to have another assessment of why they might be fatigued, whether the symptom may be. I also use an instrument to test acupuncture points, looking for food allergies and other things as well, looking for what are called focus of issues, whether that's possibly an infection, maybe a tonsil issue, a dental issue, a root canal, heavy metals or whatever. And that's kind of a general screening. And of course, I wouldn't use that instrument to say this is the issue, but I'd say I think you should see your dentist about this. I think you have a root canal, a past that shows energetically is causing some issues. They refer to a dentist. Food allergies, sometimes just willing to take the food out of their diet. Sometimes we confirm that with a blood test for food allergies. Tonsils, if there's recurring past infections on tonsils, then sometimes it can become a nest of pathogens or bacteria that is leaking stuff into the system. So there's a kind of a general review using the microscope in this unit to test acupuncture points to give us basically more valuable information. And then we design a program. Say, here are all the things that we've talked about today. Here's maybe some ways of improving those. And also then we talk about the need for purification and maybe some IV therapy just to give them a boost or reduce the pathogens. And I say, here's the possible costs of the supplements and the IVs and the purification, etc. What do you think is within your budget? What can you do what can you afford to do? And last thing I want to do is cause a lot of stress on people because of finances. So we try to design a program that fits with their lifestyle, the amount of time that they have free to come in for treatments, looking at their budget and trying to plan put out a program or a plan that might cover the next 3 months. And then we're usually reassessing every month. We might do it more often if they're doing the treatments for pathogens by using the microscope, but usually follow up in about a month to see how well they're doing and what's working and maybe what needs to be corrected or teased a bit to improve the results, or making some modifications in the program.